Good morning, everybody. I'm Greg Fisher. I'm the mayor of Louisville with our teletown halls to keep everybody updated and take the questions from Facebook land, social media land on what you have relative to the COVID-19 virus that has changed all of our lives. If your life has not changed during this COVID-19 crisis, we ask you to be thinking about how you can be part of the solution to stop the spread of this virus. That's COVID-19 virus that has changed all of our lives. What we're seeing now when cities are successful and states are successful, those that have enacted the best social distancing practices and public health practices are those that have the lowest amounts of infections in their cities and states, and that's also where they have healthcare capacity. Okay, so we need everybody to help us with our social distancing. Stay home if you're sick. Avoid getting out in public. Only go out if you have to go out for groceries, for work, what have you. Now, the purpose of today's teletown hall is to focus on public safety. You can imagine the challenges that our public safety and first responders are having during this crisis. Doing their normal job is tough enough, but now dealing with COVID-19 issues makes it even more difficult. So today we have our Chief of Police, Steve Conrad, on the call. We have our Chief for Public Services, Amy Hess, on the webcast as well, and then Vincent James, our Chief for Community Services. So we'll be hearing from them, and they'll be talking about the various agencies that they oversee and the practices we have. So again, we welcome your questions on Facebook here. Just before we kick off here, I'll throw it to Amy Hess with the overview of our incident management team. Our incident management team is kind of the nerve center of our whole response here from city government. So our job obviously is to oversee the whole city, to make sure everybody's as safe and healthy as we can. So that requires looking at a lot of information under normal times. Under these times, we're looking at all the regular info we have, but also all the information we pulled together as it relates to COVID-19 and how we deal with those issues today, but also how we look forward to tomorrow and 3 days and a week and 2 weeks from tomorrow, so we can anticipate how we can best respond to minimizing the negative impacts of this virus. Yesterday was the first day in America where more than 500 people died as a result of COVID-19. So it is in full rage mode here in America. And we're seeing the virus where it started on the West Coast, and you had East Coast concentration. Now it's coming to the middle part of our country with new hotspots identified, such as Chicago and Detroit. The Surgeon General mentioned Indianapolis on Sunday. So it's getting close to us. That's why we got to keep doing what we're doing with the good jobs we're doing for the most part in the community on social distancing. But all that data comes together in the incident management team for us to respond and plan as a city. So Amy Hess, if you would, Amy's our Chief for Public Services. She's been with Metro now I think 7 weeks or so. Amy, she joined us. We were able to lure her back home. Amy spent a distinguished career with the FBI. She came from the director's office in Washington, D.C. She's the top female in the entire Federal Bureau of Investigation, and we're proud to have her on our team. So, Amy, you've been thrown into the fire. You've done a great job with you and your team. If you could talk a little bit more about our incident management team and its approach, I'd appreciate it. Amy Hess.
Yes, sir. Thank you, Mayor. So first off, yes, clearly it's been quite the indoctrination to come into a new job. But one thing I am very happy to say is that just seeing how Louisville Metro government has come together to address this incident has been encouraging, and I think I should encourage our community as to seeing how the team is working together. So back on the 13th of March, we formally established this incident management team. And what that is a group of individuals from across Louisville Metro government and really across Jefferson County that have come together to work the incident through the National Incident Management System. And that is a very structured system that has been employed in multiple jurisdictions, actually promoted by the Department of Homeland Security and the federal government, state governments, local governments as well. And the reason it's so important to use that system is because for any type of crisis event or any type of a large scale, whether it's a pandemic or whether it's a terrorist attack or whatever it might be, that we need as a government to respond to collectively, that system brings a standardization, common terminology, a manageable span of control. It also brings organization, modular organization, so it's expandable, or you can contract it as well, depending on the size and the scope and the breadth of the incident. It also brings discipline to the system, so that we don't hopefully have a lot of efforts that are going on that people don't know about, or that we're working redundantly, or that are working in isolation. And what it also does is brings in the documentation, so that we can understand how decisions were made, how we got to where we are, what factors were considered, and then looking back, what lessons we learned from that experience. In addition to all those things, it also utilizes this process of identifying what exactly are we trying to accomplish. With every line of effort, do we have specific and measurable and achievable and realistic and time-sensitive goals and objectives? And how are we doing when it comes to resource management, with just managing the resources we have available to us? Not only the people and the money, but the equipment and everything else. And then finally, overlaying all of that to provide consistent communications, so that we are communicating up and down and across, and everybody's on the same page. So how that works is this incident management team interacts with the rest of Metro government by allowing a consistent way to track all of those things, to manage the crisis, if you will, to track all resources and processes. And that way, every agency feels a part of it and understands how it all fits together into the big picture of what we're trying to do. So that, in a nutshell, is how the incident management team is, the purpose and the goals of the incident management team. Specifically, it is housed out of our MetroSafe facility. And we do have a group of people over there who fulfill different roles, starting with unified command, and then working in each section. We have a logistics section, we have an operations section, we have basically a variety of other people fulfilling roles such as communications and safety, just to make sure we're all being safe. And so a variety of roles are being filled by certain individuals over at MetroSafe. And as part of that process, also, we're having a lot of people who are, of course, practicing good social distancing by teleworking, by dialing in. We've got people spread across that building, whereas in a normal situation or crisis, we would have everybody sitting in the same room in the Emergency Operations Command Center. But in this case, we try to spread people out, not only across the building, but also allowing them to telework. Anything that can be done remotely is being done. And that's essentially how we've managed it to date.
Thank you, Amy. So I'd like to remind our people that are watching, please give us your questions and we'll respond to those. Let's ask Chief Steve Conrad to provide some observations. Chief, being a police officer is difficult in the best of times. How is this COVID-19 crisis affecting your team?
You know, Mayor, it's added an additional layer of complexity to what is already a very complex and difficult job. I think the men and women of the local Metro Police Department are stepping up to do their best and to do what they can to make our community a better and safer place. That said, you know, we are spending a great deal of time responding to situations where people are gathering. You know, it isn't as if we are going to arrest people for gathering, but we are certainly doing what we can to encourage people to practice good health. That starts with staying at home. That continues with practicing social distancing, and in many cases, people are following that advice, heeding that advice, but you know, in other situations, they are not. And that is prompting us to interact with folks, to remind them about what they should be doing, getting together in large groups. In many cases, we've seen gatherings in some of our parks. While that is generally peaceful and obviously a legal activity, it is a potentially unhealthy activity. And people that are gathering in those situations are potentially taking virus that they might pick up there during their interactions in the park home to elderly parents, elderly grandparents, children, people that might be at higher risk for long-term damage from contracting the virus. So when you layer that on top of our response to crime, it is putting a great deal of stress on our officers. They are worried, of course, about doing what they can to make our city safe, keeping themselves in the process, which makes their wearing of personal protective gear during interactions with people that are potentially sick is very important. There are going to be situations, obviously our work requires us to go hands-on in certain situations, and when that happens, we hope that our officers are following their training, using their equipment and doing what they need to do to keep themselves safe. And then the concern for them is, of course, going home and making sure that they do what they need to do to, wash hands, get out of their uniforms, get their shoes off before they go, go into the house, because we don't want them taking anything that they might have picked up at work home. Our men and women do a wonderful job. They are professional. They are doing their best to make our community safer and do their job to the best of their abilities. But they are only human, and we are asking a great deal of them. I am proud of each and every one of them, and I think they represent our community and this department very, very well.
Thank you all for your dedication and effort during all this. So again, on Facebook, folks, feel free to put your questions in and we'll respond to them. Let's hear from Vincent James next. Chief James is over all of our community building. So Vincent, you might want to explain kind of what that means and what kind of different efforts you're seeing at this point in time.
Well, thank you, Mayor. Again, I'm the Chief of Community Building, and I have 6 agencies, governmental agencies that report to me: the Office for Safe and Healthy Neighborhoods, Public Health and Wellness, the Louisville Zoo, Resilience and Community Services, Park and Recreations, and Youth Transition Services. And we're seeing significant impact in all of our agencies. In particular, one I would like to lift up in terms of our Public Health and Wellness. Dr. Sarah Moyer is doing an incredible job. The whole team is doing an incredible job in leading this effort against this war against COVID-19. One of the things that they know, they've been battle tested before because they had received a gold standard by the CDC in terms of how they addressed the hepatitis A epidemic when it was coming through our country. And so they're doing an incredible job, but definitely the impact has been significant. I also think about our Office for Safe and Healthy Neighborhoods that is looking in terms of how to provide our community with safe neighborhoods that people can feel comfortable in living where they are, not based on their zip code, but simply based on who they are and where they are. A couple of things that have impacted that office: we have a significant outreach initiatives that go along with going from neighborhood to door-to-door canvassing. That's been limited. Also, our faith-based engagement has shifted to virtual, and this week would be the National Violence Prevention Week, where we'd have anywhere from 25 to 35,000 students participating with Jefferson County public school systems. That's been impacted, but we're continuing to find ways and creative ways of how we can reach our youth and engage our youth. We have the youth implementation team in the Office of Safe and Healthy Neighborhoods. And one of the things we're utilizing the youth through virtual meetings and conferences is to help us to be able to engage them, to identify how can we send better messages to our youth, to engage them in coming up with solutions in terms of how we're addressing some of these very complex problems. Our parks and recreations have been impacted in the closing of our recreation centers, but the good news is that our parks are open, and we want our parks to stay open, but that's really going to be contingent upon how our community responds to social distancing. That's so critical, and I think that message is continuing to be repeated. We've been talking about it since day one. Mayor Fisher, you talk about it every news briefing about how important it is that people stay 6 feet away from one another, practicing good hygiene, washing hands, if they coughing into their elbow, all of those CDC best practices in terms of being able to avoid this COVID-19 coronavirus. And so those are just some of the agencies in terms of how they've been impacted. But one of the things that I'm excited about is that we're thinking of new creative ways in terms of how we can continue to move the work forward by practicing social distancing.
Thank you, Chief. You guys, you guys all have your hands full when you got public health and wellness there, and of course parks as well, and many others. So we appreciate your good work there. So, Chief Hess, let's come over to you. I want you to talk about who you've got under your command and some of the particular issues that you all are dealing with.
Sure. So first off, public services, which is my branch, if you will, it involves not only the incident management team that I previously talked about, but really emergency services, emergency management. So these are our 911 call takers, also our 311 system. It also involves our paramedics, our EMTs. I also have the global fire and corrections, animal services, public works, and fleet and facilities. So all of those departments are working on this problem from their own different angles and ways. But one of the things particularly for our first responders, and I'm sure Chief Conrad would echo this, is that it really is that it has affected our public safety agencies in dramatic ways because they have to be even more aware of their surroundings than they were before. And whereas we have trained for years on how to approach certain known instances or incidents, well, now this adds really an invisible enemy to the picture, as we can't see it and we don't know it's there. We don't know where that attack may be coming from next. And so as a result, we are preparing our public safety personnel as best as possible by having things like the proper protection available to them, the personal protective equipment, the PPE that you hear so much about, making sure that they have enough to not only provide for them, but also for others from the national stockpile that we receive, making sure we have enough for, of course, the hospitals and the healthcare workers and the long-term care facilities and others who come into contact with positive cases. In addition to that, just making sure that our public safety personnel are aware of what they're walking into. So that brings up issues related to our 911 system. So when we talk about the 911 system, of course, typically our folks are trained to ask certain questions to make sure that they understand and they can convey to the first responders what they're about to encounter when they show up at the scene. But in this case, we had to change the script a little bit to make sure that our 911 operators are asking questions specific to the coronavirus. So those questions, are things such as, are you having trouble breathing? What are your symptoms? What types of things have you been experiencing? And really trying to gauge over the phone that level of that really possibility of exposure, so that then those 911 call takers can convey that to our first responders so that they know what they're walking into, and using a criteria such as, do you have a cough? Are you short of air? Have you been exposed to someone else who is positive for COVID-19, or somebody who exhibits those symptoms? And then being able to alert our first responders to that. That is critical so that our folks know what they're walking into when they arrive. And that's just some of the ways that our personnel have been affected. And that on top of everything else, of course, from a facilities and fleet management perspective, which is also under my portfolio, we have been taking, of course, extra precautions to make sure that we are cleaning and disinfecting and doing this on a regular basis. Multiple shifts with EMS are doing the cleaning and the disinfecting to make sure that between patients, between transportation, we are cleaning those vehicles and making the work environment as safe as possible, not only for the people we encounter in the community, but also for our employees.
Thanks, Amy. You got your hands full too. Maybe one of the things people are seeing here is how much we've got responsibility for as a city, is basically keeping us safe and keeping us healthy. And there's a lot of moving parts that go into that. Chief Conrad, what kind of, you guys and ladies are really at the front lines of this so often. What are some of the biggest misunderstandings that misperceptions you think people have about COVID-19? What's your team feeding back to you?
I think the one thing that we're hearing the most is just that sense of being able to avoid catching this virus. some of the initial information talked about the most vulnerable being older people. I've taken some offense at that description because I fall into that category. However, younger people as well, and I'm talking about children. And we have seen in this community and in this country, people as young as 5 months old and as old as 96 catching this virus, and everyone in between. And I think young people in particular, and I can remember back to the day of me feeling invincible and feeling like, it won't get me. And I talked about this a bit before, but I think that just the misunderstanding that getting around others and being with others will not, lead to you potentially catching the virus and taking it home. And it may or may not make you sick, but it sure has the potential to make others in your family and other friends sick. So the importance of social distancing cannot be stressed enough. I think one of the big misunderstandings that I think people have is that police officers and EMT or emergency medical responders, fire responders are going to be able to stand up to anything that comes their way. I mean, we have the same vulnerabilities as anyone else. Chief Hess talked about the importance of personal protective equipment. That is something we've made sure our officers have. We've given them the equipment that they need. The challenge for us is making sure that we have it available and have it on when we are interacting with someone who is potentially positive. We unfortunately had an officer exposed and he has gotten sick. He's being treated in the hospital. And we hope that he has a full and complete recovery. But this is something that can get to anybody and everyone, and we each have a personal responsibility to do what we can to stop the spread.
Chief, I talked earlier how the virus started on the West Coast, East Coast is coming to the heartland right now. Detroit is really getting significantly impacted by this. And tell us what's going on with Detroit Police Department, just so people can have some kind of point of comparison between with LMPD and what's happening with Detroit PD.
They're a large police department. They've got about 2,200 members, which is about a third larger than what we are. They have got a couple hundred officers in quarantine. They have had a number of officers put into isolation because they have the virus. They've had a couple of officers die. I believe it was one of their captains and a civilian employee die. Their chief has been exposed and has the virus and is in quarantine or actually in isolation. So it is a very challenging time for them. They handle policing a little bit differently than we do. One of the practices they have that I'm sure creates challenges for them in terms of social distancing, they work with 2 officers in each car, which creates a situation where they are exposed to each other for the entirety of their shift, which increases the opportunity for potential spread of the virus. And I don't know if that's led to the higher rate of infections, but our hearts and prayers go out to their department as they work through this. I don't think there's been a department with those kinds of numbers, with the possible exception of the New York City Police Department. They are so vast. They've got over 3,300 officers. They have got
33,000. 33,000.
120, yeah, 33,000. Yes, sir. I'm sorry, I misspoke. And they have got 2,500 or so officers out with the sickness. So just to imagine a department much larger than Louisville, much larger than Detroit, having that many people out. The cities that are hit hardest are really struggling. This is coming, our way. That's why the use of personal protective equipment is so critically important. Social distancing is something that's important for us. One of the things we instituted early on was something that we referred to as rolling roll calls, as opposed to officers coming into the division station to get instructions from their supervisors before they head out on their shifts. We're doing all of that by radio now. Officers are not coming into the station in mass. They do come into the station as needed to upload their video cameras from their body cameras. But other than that, we're trying to keep them out on the road where they need to be, and hopefully wearing PPE when they need to keep them safe.
Okay, good. Thank you. Natalia Martinez asked, would you consider a curfew or shelter in place because of the large gathering? So, Natalia, I can just say we're looking at every legal option right now. What we're trying to do is get the best of all options, and that is for our community to say together that we need to be keeping physically apart. That is the best community policing, when we all just say we know what the right thing to do is, and we're going to do that together. Obviously, we have other tools. We're trying not to go to those. We're communicating heavily this week about the importance of social distancing, and hope people pay attention. But we will we will put everything on the table if we need be, and hope we don't have to be. That's so much of the purpose of a lot of these appearances is just encouraging people get informed. Most everybody knows the virus is with us now, and the importance of social distancing. They just have got to internalize it themselves. So we're going to continue to go down that route. But yes, everything is on the table in terms of enforcement. Another question that's come in here is for all three of y'all. It says Louisville has not had the big surge that we see in other cities. We've been practicing social distance for the most part successfully. Thank you for that observation. What are your all's biggest concerns as we look ahead, and if we get a big peak like we're seeing in some of these other cities? So we'll start with Vincent, then go to Amy, then Chief.
Thank you, Mayor. I think, one of my biggest concerns is the most vulnerable population if we get a big surge. Continue to be enabled to think of ways and creative ways of how we can continue our march for meals in terms of what we've done in terms of feeding our seniors 60 years of age and older. Currently, people are driving in. We have 7 locations in which we are providing meals, 5 meals for the week. Through those 7 locations, over 26,000 people are given meals weekly. And so we've been providing that. But if we have this big surge and there's more stringent requirements in terms of being able for social isolation, in terms of how we're going to be delivering those meals potentially to those seniors and also continue to keep them safe. I think about also our homeless population. Fortunately, the good news is that we've been planning for weeks in terms of a plan, and we have a plan in terms of how we are addressing our unsheltered. We have a quarantine location, thanks to our partnership with the Salvation Army at the Joy Center. And we also have for our healthy unsheltered at the Old Mill High School on Brook Street. We have the unsheltered have a capacity to be able to go there, and we're providing meals for them there as well. But I think as this surge comes, all of those things in terms of our most vulnerable populations is going to increase. And so we are continuing to think about ways in which if and when this happens, how we're going to be prepared to be able to handle that.
And then Vincent, a question's just come on from Bink Kelly saying, have we begun to address the problem of lack of social distancing at the food shelters where homeless are gathering in large numbers daily with no 6-foot spacing?
Yes, one of the things and one of the reasons why we open the shelter for our healthy unsheltered is the fact that the shelters are practicing social distancing, and as a result of that, is limited their capacity for the number of unsheltered being in the shelters. And so we extended to the Salvation Army site that we have on Brook Street, but also we have weekly calls with the Homeless Coalition, and a lot of our partners have really come together, and the shelters have come together to talk about best practices, from cleaning the kitchens to sanitizing the rooms and providing social and ensuring the social distancing is taking place.
Okay, so this Bink Kelly, I don't know if Bink has been in the shelters, is observing that there's no 6-foot spacing as people are lined up for food. So it's something we might want to take a look at.
Yeah, we can definitely look into that.
Thank you. Amy Hess what's your biggest concern about as you look at the surge? I mean, everything we're doing, folks, in the community right now is planning so that we don't have a surge, right? So that our hospital system doesn't get overrun. But each one of our agencies have contingency plans around that as well. So, Amy, what are some of the biggest concerns that you have?
Well, frankly, my biggest concern is that we let our guard down. And so if we do that, then we start to get maybe complacent or comfortable thinking that so we're seeing empirical and anecdotal evidence that social distancing is working, but that doesn't mean we can let our foot off the gas pedal. And so what we're seeing across the community is a lot of people who are taking heed of the guidance, the instructions, the mandates that are coming down, and even voluntarily going beyond that and doing more, which is fantastic. But we do have a segments of the population who view it as hey, I'm not sick. I don't know anybody who's sick, so therefore it doesn't affect me. And so quite frankly, that's the part where I'm concerned the most, because it worries me from not only the, unfortunately, the vulnerability of those individuals, but also how susceptible they're making others and how vulnerable they're making others, to include the first responders who are trying to protect the community, the ones who are out there where if we don't take it seriously or we start to become complacent, then the first responders who show up at the scene may not be taking the appropriate precautions to be able to handle that particular scene. If you're involved in let's say a car accident or some other type of incident where first responders are called and you have been symptomatic, but you don't tell someone you're symptomatic, or you've been around people who have tested positive because you didn't think that was important. Well, now all of a sudden, not only are we going to have difficulty taking care of that individual, but also that could have long-term impact on taking our first responders out of the picture. And so we have a very robust screening process right now for our employees, and particularly for our first responders, to get them tested. But under the, obviously, guidance that you hear from the CDC and from our own public health personnel, we have to quarantine those individuals. And then individuals who came into contact with the first responders who may test positive. And so you're talking about lasting impacts across our first responder community, which just further deteriorates our ability to be able to address the problem and to be able to help the community, which is obviously our mission and our goal.
Gotcha. Chief, what about you guys? And then we've got a comment coming in on Facebook saying that I see LMPD officers doing nothing to break up large groups of people in public. What can LMPD do and not do? So I'll maybe answer that question, but then also talk about your biggest concerns with the surge coming.
Of course, as I said during, my opening comments this morning, people getting together in large groups is not illegal. It is unwise. It is unhealthy. It is creating an opportunity to spread this virus to friends and to family. Our officers are doing their absolute best to discourage people from gathering. But the challenge we have is again, people ignoring the good medical advice that is being offered all across this country, and particularly in this community, with the thanks to you, Mayor, and Dr. Moyer, and the directives that have been issued by Governor Beshear. And people just are not heeding that advice. It is creating challenges for us. We cannot arrest someone for standing too close to another person, nor do we want to arrest a person for that. You think about a particularly vulnerable group of people that are kept, in a position where they cannot get away and cannot social distance, is in Metro Corrections, another very important partner in terms of being first responders. And although the numbers at the jail are much lower than what they have been, there are still over 1,000 people there, and putting additional people into the jail that may have the virus would introduce, that population that has no choice about leaving in significant danger. So We are asking for cooperation. In some cases, we are begging for cooperation, but we do not have, at this point, the authority to make arrests for lack of social distancing. Back to the largest concerns about the surge. I mean, first, I am concerned about the influx of people at the hospitals here in our community. We already have officers staged at the hospitals along with members of the Kentucky National Guard to help with security at those hospitals. And you know, we may be there a bit earlier than is necessary, but really at this point, we don't know when that surge might hit our community. We hope that it doesn't. We hope that we practice the social distancing and the proper hygiene that we need to avoid catching the virus, but making sure that we are ready to allow the medical professionals to do what they need to do and to keep the hospitals safe. You know, the other challenge that will come to us, I think, over time, and when I say us, I'm talking about all first responders. You know, right now we are getting a heads up in terms of calls for service that may involve someone who is symptomatic, which allows officers, EMTs, and firefighters to don the appropriate personal protective equipment. But as we see the spread and everyone you're interacting with is potentially infected, there may or may not be symptomatic, but potentially infected, creates a challenge. You're talking about wearing personal protective gear on every call, on every interaction, and that will put a strain on all of us.
All right, thank you. I've got a Facebook question here that's a little bit lighter. I've heard the advice that it's okay to take short walks and wonder if that means I can't take longer walks. Is time outside more dangerous if it's 19 minutes or 49 minutes? Assuming one is in a very spacious neighborhood. You can take a long walk. You know, as long as you're not around other people and keeping distance, you can walk all day. But the main thing, obviously, is just keeping distance from folks. And it is great to get outside and get fresh air. We know this is a health crisis, and we think about the physical impact on it, but there's a big mental health impact on us as well. So the more we can get outside and keep distance, the better. So you just keep on walking to stay apart from people. All right. Chief just raised an interesting question, and maybe we can collaborate here between Amy Hess and Steve Conrad. We've had a few people that will not comply with the stay-at-home orders when they have the virus. So maybe who's best between you two to kind of walk through how we've been able to get the legal authority to make people stay at home, how we do that, and then some of the dangers involved, and how we plead the people in the community that if you have the virus and you have to stay at home, don't make the police department or the corrections department come to your house and enforce that. I mean, that is not what we need in terms of good citizenship. So, Steve and Amy, if you don't want to talk through how all that evolved and where we're at on it right now, take it away.
Chief Hess, if you don't mind, I'll jump in. We've had a couple of situations where people who have been diagnosed as actually having the disease, they were instructed to isolate. They have refused to do so. That has created a problem, obviously, danger of them potentially spreading the virus. What we're able to do, working with the county attorney's office and the Jefferson County Sheriff's Office and the health department, was to get an order that essentially a court order that ordered that person to stay at home. That order gets served by the sheriff's office. In the first case, we ended up stationing LMPD officers at the person's home to make sure they stayed inside their home, which was not a particularly good use of police officers or deputies from the sheriff's office. Sheriff Aubrey made a very astute recommendation that we were able to follow up on in partnership with Metro Corrections. And that has been the use of the bracelet that we use, or that Corrections uses to monitor people that are on the home incarceration program. And when we had with that first individual, we were able to get the order to have that bracelet fixed to that patient, and that person has complied and stayed at home. We've had the 2 cents, and we're able to go through that process that was much more streamlined because we had been through it all before, and we're able to have the HIP bracelets installed, and we've been able to be in a position to react if they leave their home without having to station personnel there full time.
Yeah, and I would just add that, yeah, from the corrections perspective, is that the home incarceration program is exactly, I think, well suited for this, because just like Chief Conrad said, is having the ankle bracelet provides us with obviously the proper amount of distancing, so that we can monitor that person's activity after we get that bracelet assigned and affixed to them. Is that now we can back out and we are not further exposing our first responders, our folks who are in those vulnerable positions. But we can also monitor that person's activities to make sure that they're not further affecting their community. And so while I think that has been very successful, clearly we would prefer to not have to do it at all. We would prefer people to comply with the order to begin with, to comply with the social distancing and the requirements that we're seeing to begin with, so that we don't have to go down that path. But that has been an effective solution to that particular problem so far.
Great. Just a reminder to everybody in Facebook land, I'm Greg Fisher, the mayor of Louisville. So we're taking your questions right now to our public safety and first responders. Any questions you have, any comments you have, any suggestions you have, please throw them our way. A general question is coming in from Jane saying, can a business operate if social distancing is in place and they're limiting the numbers? The only businesses that can be operating right now are those that are deemed essential businesses, which is quite a long list actually. And you can find that list at the COVID-19.ky.gov website or at louisvilleky.gov. And if you are an essential business, you can be open as long as you are practicing all of the proper social distancing. Let's switch it over to Vincent James. VJ, tell us a little bit about some of the, we're going through a tough time right now, and everybody, that's understandable, everybody, but we're seeing so many good things taking place in the community, and you're known as a person that is constantly uplifting people. So what kind of good things do you see in the community that you're speaking?
I see a lot of great things happening, Mayor. I think, when a crisis comes, you really can tell what type of community you have. And we're seeing our community from the foundation, the philanthropic community stepping up. It's incredible. The One Louisville COVID-19 Relief Fund that is providing resources to families and nonprofits, and seeing people literally coming together. The other day, my wife was sharing with me, she was standing in line, and an 89 and a 90-year-old husband and wife was there, and she let them in front of them. And then other people started doing the same thing as they started seeing our senior citizens standing in a grocery line. And just simple things like that. Other things I'm seeing, neighbors checking on one another. Literally, you can see it in the communities, people going door to door in their neighborhoods and communities. And I get an opportunity to see these things as I'm driving around in the communities, looking at our parks and looking at other things that are happening. But it's exciting to see, even in the midst of this crisis, the humanity that people are displaying, all over the city in so many different ways. It really goes off to those frontline workers at the grocery stores, those grocery store clerks, and how they are showing up to work every day, committed to their cause, as well as our police officers and our emergency officers. But those unsung heroes that we don't hear about, those neighbors that are simply looking out for one another. And that's some of the most exciting things that I've been seeing as a community that's really coming together and learning how to live in a different way. One of the things that I hope is that when we get past this, that we continue to maintain the closeness and connectivity that we're learning about. Even through social media, we are learning in terms of how utilizing different platforms to be able to connect with one another. And what I'm seeing is even some of our seniors who are not used to technology, a learning how to use technology. And it's an amazing thing. My father, who's 83 years old, for the first time in his life, signed on and got onto FaceTime on his phone. And so we've been working with him, and it's exciting because we want to keep him healthy and stay distant, but at the same time, staying connected.
You throw that little grandson or great grandson on there too, boy, and that's when everybody's faces light up with a smile.
Oh yes, the other day I saw him and his father. They were fishing, and I remember when I used to take my son fishing, and my face just lit up with joy.
Yeah, yeah. No, everybody can put a smile on their face, right? It doesn't cost you anything. It does lift everybody's spirits.
Exactly.
Let's see. Questions coming in about first responders. Are we taking temperatures at the beginning of the shifts? Uh, how are we doing that with LMPD? How are we doing that with LFD, the fire department?
Chief Hess, I'll let you go first.
Yes, so definitely at the fire department, we have been doing that for the shifts. I start the shift, end the shift. EMS, same thing, actually multiple times a day, and then also not only just the temperature checks of our folks who are the first responders, but also the people who work around those individuals. So the people who are entering those facilities. For example, every time I go to our emergency operations center at MetroSafe, I get my temperature checked. And so they will tell me, they'll log it down, and to make sure that we are all, I clearly not only knowing what we ourselves are experiencing, but also know that we could potentially be exposing others to symptomatic people. And so that's clearly a very important part of that. Also asking our employees, in particular our first responders, to pay really close attention to yourself, to be doing that self-monitoring, so that if you feel a little funny, or you have suddenly a cough, or you have shortness of breath, to pay attention to that and to make sure that you are reporting that, and to stay away from folks until we figure out what exactly is going on. And then finally, just the cleaning of our facilities. As I mentioned previously, the continual cleaning of our vehicles and our facilities and our work areas, to make sure that that's happening on a regular basis as well.
We've taken a slightly different approach. One of the things that I mentioned earlier in the call, in the interest of making sure that we practice good social distancing ourselves, is we've done away with roll calls where officers would come into the station and get information about their shift and then go on about doing their work. That would allow the perfect opportunity for the supervisor, as they report, to be taking their temperature. But we trying to work through the logistics of that and make sure that no one was going to get sick by virtue of that preventative process. What we have done is we've issued an order for all of our employees to monitor themselves. They're all taking their temperatures before they report to work. I took mine this morning before I left for the office, and we have provided directions on what they are to do if they come up with a temperature of 100 degrees or more, or if they're exhibiting other potential signs of the COVID-19. We have directions for them to contact their supervisor, and they're following up with one of our health and safety officers to get the proper direction and care that they need.
Thank you, Chief. We got a question in here from Paula. Yesterday, Governor Beshear, who's been doing a great job during all this, by the way, in my view, and many other people's views as well, is putting some travel restrictions in. You know, if you don't need to travel out of state, don't go out of state. That presents some kind of interesting complications for us, in that the next state is a couple hundred yards across the river. So Paula asked, is it okay if my son goes pick up his son from Indiana? Chief, how would you make a call on that one?
I would believe that he would be able to do that, sir.
Yeah, that would be my judgment as well. Now, there are some hot spots in Indiana, right? So if your son is in one of those hot spot areas, then you should quarantine when you come back home. And that's what we're asking for people when they're out and about. And the quarantine is 2 weeks. Okay, so you want to, we don't know how old your son is here or what the situation is, but we want you to exercise common sense. And if you are at all around affected folks, then you're going to have to quarantine on something like that. Okay. Farhan Abdi. Farhan, thank you for the question. Good to see you're online here today. COVID-19 fund is taking weeks to get to respond for qualified families. What can we do to process it faster? Okay, so Farhan, we announced the fund about 12 days or so ago, and the first checks have started to go out. So we've had 800, it was 800 families have been, 200 families have gotten the first checks, average $800. So that process is happening right now. The checks go directly to your landlord. It could go to utility, wherever that particular challenge might be financially. So we were overwhelmed, frankly, with the thousands of calls that came into our neighborhood places. So we put 5 times the amount of callers that we had on that now to process this. You can go to louisvilleky.gov, click on the top left there on the One Louisville Fund to see what the eligibility is. And then, Farhan, you can work with Sabine Nassim, who runs our Office for Globalization, or the neighborhood places. We should be seeing that increase in pace. And this is one of the challenges right now. Fully recognize that the federal government has some direct relief checks coming to our folks in the country here, but they're going to take 3 weeks to arrive. The question is, what about the time between now and then? That is going to be tough for some people. So the One Louisville Fund is designed to help that. Community Ministries, Dare to Care, they're designed to help that as well. So please seek out all those different avenues, and then people just help each other during this time frame. We realize this is a difficult time for folks, and that we can all move as fast. We all need to move as fast as we can. So we'll certainly do that. But thank you for the question, Farhan. Okay, well, let's kind of wrap it up here with just some final comments from each of our presenters here. We'll go with our police chief, Steve Conrad, for any final thoughts you want to leave our viewers here this morning.
Mayor, thank you, and I appreciate you pulling this together and giving us an opportunity to speak to the broader community, at least in Facebook land, and to be able to share some important reminders about the importance of social distancing, the importance of taking care of your family, of good hygiene. We hope and pray that this community continues on its course, and we end up with much fewer cases than what we're seeing in other comparable sized cities and in other states. But we don't know where we're going to end up. I will assure you that no matter which way things go, the men and women of the Louisville Metro Police Department stand ready to do all they can to not only respond to this problem, but to respond to other crime problems that will inevitably occur in this community. We are blessed to have a really truly professional group of men and women that have made this job a calling, and their work and their efforts shine through each and every day. We have a wonderful, resilient community, but it's going to take all of us working together to stay safe through this pandemic.
Yeah. Thanks, Chief, to you and the team.
Thank you, sir.
Amy?
So in final thoughts, I would just say that, again, being new to local metro government, it has been enlightening, and it's also been extremely encouraging just to see the way everybody comes together in metro government to try to address this problem, to try to protect the community, to try to do everything possible to try to keep people safe. And it's clearly a community-wide effort. And to see different people in the community who are doing everything they can to try to help to recognize that nobody likes this current situation. We, by nature, humans are social beings, and we don't like being separated from each other. But to recognize that there is a greater good out there by limiting our exposure to other people, not only to prevent your loved ones from being impacted, but also the very people who are trying to ensure your safety, the public safety agencies that are employed here throughout metro government, those not only first responders, but their families as well. So they can come back tomorrow and do that same job to try to protect you and to try to protect the community tomorrow. And I have been highly encouraged and just heartened by what I see across not only Metro government and our employees, but also across the community as we all try our best to get through this in the best way and hopefully the safest way we can.
Thanks, Amy, to you and your team. Let's bring it home, Reverend James here with some closing remarks.
Where we are today, had it not been for your vision to be able to think ahead and have all the things that we have in place today to be able to move forward. And while we're seeing the results we already are seeing. So thank you for your leadership. And I want to thank the community because we are truly seeing the beauty of humanity and the connectedness by staying apart. And that's an oxymoron in terms of how do you stay together? You know, we talk about better together by staying apart. We are better together because we are seeing so much happening around our community, how people are really pouring out to help each other, to support each other. Instead of turning on each other, we're turning to each other. We see civility come back to our community. Sometimes it takes a crisis to really cause the things that you know that you have inside of you to come out. We know we've seen in previous days prior to this, some ugliness happening in our community. But now we're really seeing the beauty of humanity coming together in a time of a crisis. And that's why we know we're going to get through this. We're going to get through it. And as you say, we're one day closer to finishing it.
Well, thanks to all of our great panelists here, Steve Conrad, Amy Hess, and Vincent James. And thanks for everybody for watching. Hopefully you're more informed around our first responders and public safety officials. It is a 24/7, 365-day responsibility. And it truly takes some special people to want to do this kind of work and want to serve the community and really ask for nothing in return. So I can tell you, I'm a proud member of the Louisville Metro government team, and we want everybody in the community to feel like they're a member. You pay taxes, you are part of this team, and we need your help. We've been getting your help as we get through this COVID-19 crisis, and we all know intellectually we will get to the other side of that. So now it's just all of our jobs to do our role, to make sure we get there as soon as possible. So keep up the good work. Thanks for tuning in. We'll be checking in with you soon. We have a 4 o'clock media briefing if you'd like to join us every day for that, except Saturdays. And then these teletown halls are happening about 10 o'clock every other day or so. Thanks, everybody. Take care today.